Okay, so the study that I looked at was called The Effects of Aquatic Physical Therapy on Balance and Gait of Patients with Parkinson's Disease. So basically, does aquatic therapy and getting in the pool and stuff like that help with the land and balance coordination of those with Parkinson's? So, Parkinson's disease is a chronic, progressive, and neurodegenerative disorder. It's kind of genetic, kind of environmental. They're not quite sure um, about which combination of factors will allow it to be expressed in a person. It's more diagnosed just by the physical aspects and symptoms of the disease. So those symptoms can include tremors, rigidity, bradykinesia, so just moving slowly, postural instability, of course, slurred speech, and reduced facial expressions. Um, so all those things can kind of add up to having a not so great quality of life. And there are a lot of studies being done about how to decrease the tremors and stuff like that. But this particular study went with a group of 17 patients. They were aged 50 to 80, um, and they were between a 1 and a 4 on the Hone-Yar scale. So that rates the deterioration of motor skills and functional ability from like a 1, which is no real disability, to a 5, which is very severe, and they can't really move without assistance at all, like getting in and out of wheelchair, walker, or whatnot. Um, the things that they tested for on the before and after, so the basis for their assessments were the time up and go test, so the tug. So that's how fast can a person get up out of a chair and then go to a mark on the floor that's 3 meters away and then come back down and sit in the chair. And then they also measured the dynamic gait index. So that measures like when a person is walking, how are they able to respond to given tasks? Like if you're walking, would they be able to catch a ball? Would they be able to reach for an object? Stuff like that. They use the Berg balance scale, so that is different variations of sitting, standing. Like, can they balance on one foot? Can they get out of a chair regularly? Can they balance with their eyes closed, just regularly standing up? All those are rated. All those movements. So each movement has a rating scale on some from 0 to 4 on how well they perform that motion. And then the last thing that they used to measure before and after was the Unified Parkinson's Disease Rating Scale. So that has 4 parts. The part that they looked most closely at was the second part, which was motor experiences of daily living, which obviously is really significant to the Parkinson's patients, as they're going to physical therapy to try to help improve their quality of life. Um, so again, this study was looking at how an aquatic therapy intervention could benefit patients with Parkinson's disease. So, especially in their gait and balance. So, the intervention occurred over 3 months, which is, I think, a really good time span for this experiment because it's a very feasible and practical, realistic time for physical therapy to occur. So, they did 3 times a week for 40 minutes a session. So, that gives you a total of 36 sessions over 3 months. The aquatic physical therapy um, consisted of about 5 minutes of warm up. So that's just like multi-directional gait movement. So forward, backward, side to side, warming up there. And then they did 10 minutes of rhythmic activity. Um, so that's coordination and balance with the patient having to change directions. And they also played different rhythmic music in the background, which I thought was really interesting to kind of stimulate the different motor coordination patterns. They didn't really say too much about that, but it'd be really cool to kind of do it almost a secondary study on what kind of the cognitive effects of the musical rhythm would be. I don't know. That seemed kind of cool to me. Um, so then they did 10 to 15 minutes of trunk exercises. So those were a lot of rotational movements, which were really good for balance and coordination and stuff like that. The last 5 to 10 minutes was water relaxation and stretching. Um, with that study, they did find a statistically significant result, especially with the Berg balance study. The, wait, no, the Berg balance scale. My bad. And the Unified Parkinson's Disease Rating Scale. So the balance scale and the overall disease rating scale, especially on again that second part of it with the motor experiences of daily living, were the most statistically significant when looking at this study. Um, a lot of the previously cited studies that were mentioned by this author were citing the properties of water as a huge help in the interventions. So the hydrostatic pressure and the turbulence, kind of those underlying currents in the water, give a lot more depth to balance exercises than you might see on land. Um, and they also noted that the hydrostatic pressure could also help with opening up the peripheral arteries and optimizing oxygen delivery, which could also help with the different movements and whatnot. So, in conclusion, it was a small sample size, but done over a realistic period. Biases not too many because of the realist or the objective testing methods. But aquatic therapy is known in general for help building balance, so that kind of could have skewed their intentions going in. But results were especially significant given that the patient saw the most improvement on section 2 of the Parkinson scale, and with a higher balance score on the Berg balance scale, they have a higher level of autonomy and quality of life, which is the whole goal of physical therapy. So in conclusion, physical therapy is really great for or aquatic physical therapy is really great for Parkinson's patients.